Hi, everyone. Welcome back to another hormone webinar. And this is part 4, and it's all about testosterone. My name is Heaton, and I am the clinical liaison for women's health. Today, we're going to be talking about testosterone, where it's produced in the body, discuss the functions of testosterone, the causes of low and high testosterone, some signs and symptoms of low and excess levels of testosterone, the myths about testosterone use in women. We're going to go over the benefits of testosterone therapy, the dosage forms and usage, side effects of overdosing testosterone, and some clinical pearls. When I think of testosterone in women, especially when there are ample amounts and their levels are healthy, I think of a strong, healthy woman who feels good, who has energy, who has the get up and go, who has the drive and the zest for life. And in this picture, it shows all of that. So what is testosterone? It is a male hormone, and it is in a class of hormones called androgens. It is the most active hormone in both sexes. So we think of testosterone as being the main hormone in men, which it is, and it being the most active in men. But believe it or not, it is active in both men and women. It's made in the ovaries and the adrenal glands. And the ovaries actually secrete testosterone directly into the circulation. But the adrenals, on the other hand, they mainly secrete the precursors, which is the androstenedione, the DHEA, the DHEA sulfate, which are converted to testosterone peripherally. And then testosterone can then act either directly or through the conversion to dihydrotestosterone using alpha reductase or the aromatase enzyme to estradiol. So this is the biosynthesis of hormones, and this is the adrenal and sex hormone cascade. And in this slide, the big takeaway is that all of our hormones, whether they're adrenal hormones or sex hormones, they are made from cholesterol. It is a vital component in making all of this. And so if you are on a statin drug, and your numbers are below 140, that might be something you might want to have a conversation with your doctor about. Just because cholesterol levels under 140, generally it will shut this whole process down and you will not feel good. So it starts off at cholesterol, and using the cytochrome P450, it's converted to pregnenolone. And pregnenolone is the mother of all hormones. And from pregnenolone, you will see that it makes all of the vital hormones. You've got your progesterone here, and here using 3-beta hydroxysteroidehydrogenase, it is converted to androstenedione, and from there you've got 17-beta hydroxysteroidehydrogenase, and it goes directly to testosterone. Now, testosterone can be converted using the 5-alpha reductase into DHT, which is dihydrotestosterone, or it could be aromatized using the aromatase enzyme, and it's converted to estradiol. In women, testosterone is primarily produced 50% through the peripheral conversion of androstenedione in adipose tissue. The other 25% is made in the ovaries, and the final 25% is made by the adrenal glands. And women only make about 1/10 as much as men. Postmenopausal ovaries continue to produce testosterone after the cessation of follicular activity cuts off the supply of estrogen. And as the ovary falls, it continues to produce testosterone, and perhaps in increased amounts and for a variable number of years. And this actually is it's called the continuation of ovarian function postmenopausally. There are androgen receptors all over the body. It is in every organ system in both men and women. And as a result, the testosterone has a function at those androgen receptors in every organ system in both sexes. So androgen receptors are located throughout the brain and the nervous system. And one of the most important functions of testosterone is that it is neuroprotective. And as a result, you will see it mediates the neuronal and vascular aging in neuronal cells of the hippocampus. The hippocampus is so important for memory, for long term and short term, and it's also important for motivation. So it is involved in cognitive function. It's also involved in spatial cognition, and that's basically, going into a room and knowing where you are and how you got there, and focus. It helps with verbal learning and memory. It helps with sleep. It reduces depression and apathy. It's an immune modulator, so it regulates the immune system so it doesn't get out of hand. It regulates the beta amyloid, and that's the protein that creates plaques in the brain, which is a major risk factor for Alzheimer's. It also plays a role in the regulation of cellular plasticity in the CNS. So it regulates your neurons and how much you can make and maintain them. It also stabilizes mood. So it decreases anxiety. It increases norepinephrine in the brain. So it boosts your energy. It makes you feel better. It increases self-confidence, that sense of emotional well-being and motivation. And it has a therapeutic role in conditions like Parkinson's and MS, dementia and Alzheimer's, migraine headaches, and chronic pain, like in fibromyalgia or peripheral neuropathy. There are androgens also in your hair, scalp, and skin. And testosterone is a precursor for dihydrotestosterone, which is DHT through 5-alpha reductase. And DHT causes hirsutism, which is hair growth that's inappropriate, usually on the face or the chest or the back in women. Sebum production, which is just oil, you're just getting more oil in your skin. Male pattern baldness, acne. Testosterone thickens the skin. It decreases fine lines and wrinkles. And that's what a lot of women battle as we age. We lose the collagen, our skin begins to thin, and you start to see those fine lines pop up a lot easier and a lot more. It also increases muscle tone. It prevents that skin sagging. And of course, as women, we see the sagging in our face and the sagging in our breasts and in our arms. It accelerates wound healing. There are also androgen receptors in our eyes and mouth, so it does improve dry eyes. Testosterone also improves dry mouth in Sjogren's syndrome. Sjogren's syndrome is an autoimmune condition where the mucous membranes and the moisture secreting glands of your eyes and your mouth are affected first, resulting in dry eyes and dry mouth. There are androgen receptors in your breast and mammary glands, and it decreases ER alpha, which is very good because the ER alpha receptor is the estrogen receptor that is very proliferative, and it also increases the ER beta. And ER beta receptors are estrogen receptors that are very protective of breast tissue. It inhibits proliferation and hyperplasia of the breast tissue. Testosterone also is very protective against breast cancer by inhibiting breast cancer growth. It also increases chemotherapy responsiveness in ER positive patients. There are reduced incidence of breast cancer in women treated with testosterone therapy. And there's also a reduced incidence of recurrence in breast cancer survivors treated with testosterone, or the combination of testosterone and an aromatase inhibitor like anastrozole. And it improves the quality of life in breast cancer survivors. Very, very protective of the breast. There are androgen receptors in the uterus, the bladder, and the vagina. It prevents the proliferation of the uterine lining, and it treats fibrosis and dysfunctional uterine bleeding, or DUB, and endometriosis. It strengthens the bladder. It improves that muscle tone, improves incontinence and urgency. A lot of women come into the clinic with that particular problem where they have urinary incontinence and there is leakage. And it's very embarrassing. Even a gentle sneeze or a cough can trigger it. Has positive effects on vaginal blood flow. It improves vaginal strength and lubrication. And it also treats lichen sclerosis. So, lichen sclerosis is a chronic condition that causes thin white patches of skin, usually around the genital area. And it primarily occurs in young women who have not started their menstrual cycle and in postmenopausal women. And it's related to so many different factors like hormonal, genetics, environmental, and immune factors. There are androgen receptors in the ovaries, and testosterone is a precursor to estradiol in the ovary. It stimulates ovulation. It is involved in follicular development and maintenance, and it increases sex drive and libido. Adipose tissue. This is number one for women. It decreases visceral fat and reduces waist circumference. So a lot of women will come in with that middle age spread, and especially that spare tire, and they can't figure it out. They've never gained weight, and especially in the middle. And it is the most frustrating thing. They eat hardly anything, and they go exercise 7 days a week. They do everything they know to do. They cut out gluten. They look at everything. They cut out everything, and they're losing ounces. And this is why. Androgen receptors are also in the GI tract, the pancreas, the liver, and the kidneys. So testosterone increases insulin sensitivity. It improves glycemic control. It increases glucose tolerance, enhances glucose stimulated insulin secretion. So it's very good for blood glucose control. And without it, you just lose that insulin sensitivity, and it just predisposes you to diabetes. It's anti-inflammatory in the gut. It also helps maintain homeostasis of your lipids. So it helps your cholesterol profile be more balanced. It also stimulates erythropoietin. So it helps to make your red blood cells. It suppresses the development of fatty liver and cirrhosis. And fatty liver is rapidly becoming a major problem in this country. And it's mainly because of our diet, high in carbohydrates and sugar. Androgen receptors are also in the heart and blood vessels. It inhibits plaque development. It is a vasodilator. It strengthens the cardiac muscle. It increases cardiac output. It has angiogenic effects, so it improves the growth of new blood vessels, reduces arterial stiffness. It improves oxygen consumption. It increases functional exercise capacity. You can actually exercise longer. It has therapeutic effects in congestive heart failure. It also inhibits platelet aggregation, and it reduces the incidence of thrombosis. It reduces your risk of clots. So testosterone is very cardioprotective. It is also very protective of our adrenals. It helps in the stress response and in the endocrine system. It decreases the stress response by inhibiting the HPA axis reactivity to stress, and it decreases stress-related neuropathology and neuro-related psychiatric disorders. So it helps greatly in depression and in post-traumatic stress disorders. And there are androgen receptors in your muscles and joints. So it relieves pain. It helps in pain control. It is anti-inflammatory. It increases lean muscle mass and improves strength. It is effective in autoimmune diseases like rheumatoid arthritis, and it's used as therapy in sarcopenia. And sarcopenia is really the death of us because it is muscle wasting. And as we get older, we actually lose muscle mass. And as a result, it's really flesh wasting. And when we lose that, we lose a large part of who we are. And our strength, our drive, our zest for life goes down. Androgen receptors are also in our bones, bone marrow, and the immune system. Testosterone is a precursor for estradiol in the bone and bone marrow, which of course increases bone density. It also decreases bone deterioration, and it reduces bone turnover. Again, it stimulates erythropoiesis. Testosterone increases nitric oxide and inhibits platelet aggregation. And nitric oxide is a signaling molecule in the body, and it's responsible for a myriad of health benefits, such as lowering blood pressure, improving blood circulation. It also relaxes blood vessels. And testosterone reduces inflammation as well. It reduces the systemic inflammatory cytokines like TNF alpha, IL 6, IL 1 beta, and it increases the anti inflammatory cytokine IL 10. And here, this is just a visual of the role of testosterone and its effects on the body. And I don't think here there is anything that we have not gone over. Testosterone deficiency, it is defined as a medical condition that is caused by low serum testosterone levels, which results in your typical symptoms. It's also known as low testosterone, low T, and hypogonadism. So testosterone starts to decline in both men and women in their 30s, but the levels can decline at any age. And when levels decline in younger people, it's usually due to stress and nutritional deficiencies. Testosterone levels of a perimenopausal woman tend to be half those of a woman in her 20s. And the steepest decline is shown around menopause. But after menopause, the ovaries do continue to produce both testosterone and androstenedione. And here is just a graph showing the decline of testosterone with age. And notice that we peak in our 20s and there's a steady decline. And by age 50, actually 40, it looks like we're pretty much halfway depleted. Some causes of low testosterone, of course, menopause, natural or surgical, with the removal of the ovaries. Oral contraceptives, it does increase the sex hormone binding globulin, and that's a protein that actually binds up testosterone, so you don't get as much of the free testosterone to be used by the body. Childbirth, adrenal stress or burnout, that is becoming the number one cause of low testosterone in younger men. Adrenal suppression from drugs like high-dose prednisone, endometriosis, depression, psychological trauma, chemotherapy, and the statin drugs, which are the HMG CoA reductase inhibitors. So here's your visual, and it looks like everything we've talked about. Signs and symptoms of low testosterone. So everything starts to sag. Your skin overall just goes south. And we start to see it, we start to feel it, and it's just not pretty. And we get the droopy eyelids, the saggy cheeks, the thin lips, very dry, thin skin with poor elasticity, dry, thinning hair, loss of pubic hair, and muscle wasting. And that's even with adequate calorie and protein intake. And you add sarcopenia into that as we age, we have muscle wasting, and that's not really good because it really creates a weaker frame. We end up not being healthy at all. Decreased sex drive, mild depression, and everything pretty much was mentioned. And of course, increased body fat is the other thing. You know, a lot of women do tend to be shocked by how all of a sudden they're gaining a lot of weight around the middle for the first time sometimes in their lives. And despite the hard work in the gym, despite eating well, cutting down on the triggers like sugar and gluten, eating less even calorically, and they are still gaining that weight, and particularly in the middle, that spare tire that comes up. And signs and symptoms of testosterone excess, too much, will create depression. So notice some of these signs and symptoms kind of overlap between testosterone deficiency and testosterone excess. You've got depression, mood swings, irregular periods, acne, oily skin, anxiety and agitation, anger, fatigue, changes in memory, hair loss, hirsutism, increased insulin resistance. And because there is an imbalance here, we get these signs and symptoms between low and high testosterone. And some more signs and symptoms. So your good cholesterol, the HDL, will be lower. You'll get more fluid retention and hypoglycemia. Your blood sugar will be lower. Increased risk of developing breast cancer and poor prognosis if you do have breast cancer. And you'll tend to have salt and sugar cravings, so you want to eat. The urge to eat, again, creates that midsection bulge and, of course, weight gain. Some causes of high testosterone: polycystic ovarian disease, PCOS, perimenopause, menopause, of course, too high prescribed dose of testosterone, high DHEA levels, and aggressive exercise program. So let's go into some myths about testosterone use in women. There hasn't been a lot of studies for testosterone use in women, but there's a lot of myths out there circulating about testosterone, and I think it scares a lot of women from using testosterone because of just not understanding what the hormone is really about and how it can benefit them. So the first one is testosterone is a male hormone. Well, it's not, because even though men have higher circulating levels of testosterone than women, quantitatively, it is the most abundant active sex steroid in women throughout the female lifespan. It is even higher than estradiol. Myth number 2, testosterone's only role in women is sex drive and libido. That is totally not true, because there are androgen receptors located in basically all of your tissues, and that includes your breast, your heart, your blood vessels, your gut, your lung, your brain, spinal cord, your peripheral nerves, your bladder, your uterus, your ovaries, your endocrine glands, vaginal tissue, skin, bone, bone marrow, synovium, muscle, adipose tissue, all over from head to toe. So wherever there are androgen receptors, testosterone can work there, and it's very beneficial when it is at appropriate levels. Myth number 3, testosterone causes hair loss, and that's just not true. Hair loss is complicated and it's multifactorial. So there's a lot of different factors that play into hair loss, including environmental, genetics, hormonal imbalance. There's a lot of reasons, and it is common in both men and women, and who have insulin resistance as well, and obesity, insulin resistance. Both of those can increase the enzyme 5-alpha reductase, which of course increases the conversion of testosterone to dihydrotestosterone in the hair follicle. And it's actually DHT that can actually cause more of that potential hair loss. But again, increased DHT, lower testosterone, and elevated estradiol levels can contribute to hair loss in any genetically predisposed men and women. And medications can do it. Stress, nutritional deficiencies, all can create this. So it's not necessarily testosterone. Testosterone myth number 4, testosterone masculinizes females. Outside of suprapharmacologic doses of synthetic androgens, which means that the doses are very high, they are outside of physiologic levels. Does testosterone have masculinizing effects on females or female fetuses? Outside of that, it does not have masculinizing effects on females. Myth number 5, testosterone causes hoarseness and voice changes. Honestly, the common causes of hoarseness are inflammatory in nature, such as allergies, infections, reflux, mucosal tears, medications, and vocal cord polyps. So there is no evidence that testosterone causes hoarseness. There's no physiologic mechanism by which testosterone could be expected to do so. So there's no conclusive evidence that testosterone therapy causes hoarseness or irreversible vocal cord changes in women. So there's a lot of different reasons why there would be hoarseness, but there's no physiologic evidence that shows that testosterone causes hoarseness or any voice changes. The benefits of testosterone therapy, I'm going to review again, but we went through a lot of the functions of testosterone earlier. So this is really, in many ways, a recap. It improves memory because it's very neuroprotective. It reduces depression. It helps with anxiety disorders. It improves aging skin, increases sexual interest in women with low testosterone levels. It reduces the risk of osteopenia and osteoporosis, and it helps in weight loss. And some other wonderful benefits, it shuts down gene expression of ApoE4, and that is the gene that is linked to Alzheimer's disease. It protects the brain by protecting the mitochondria, and the mitochondria is the powerhouse of our cells. It helps cholesterol stay at a healthy level. It is very heart protective, and it protects against breast cancer in breast tissue. And again, this is the myriad of benefits that testosterone has. It's more than just libido, it's more than just sexual interest. When you've got protection against diabetes, protection against high cholesterol, your muscle tone, improving strength, increasing energy, increasing mood, and making you feel and look better, a healthier body composition where you've got more lean muscle mass. Testosterone is the way to go if you really want to improve your quality of life. Testosterone dosage forms. Currently, there are no FDA-approved testosterone preps for use in women, and the use by clinicians is through dose modifications of FDA-approved therapies for men, or their preparations that are created through compounding. The only available product for women is oral, and it's actually a combination product. It's not testosterone only. It's called Estrotest. It's esterified estrogens, which is a mixture of synthetic estrogens and methyl testosterone. And so if they are on this, they have to be closely monitored for signs of endometrial cancer, fibroids, gallbladder disease, and any effects on the liver, just because methyl testosterone is toxic on the liver. So these are some common dosage forms of testosterone for women. The IM form, it's in pellets, it's in transdermal, and also transvaginal. Oral therapy is not as common just because, again, oral testosterone is very hard on the liver and it degrades quickly. It's not as bioavailable, but it's still available. So these are the common compounded dosage forms of testosterone for women: topical, vaginal creams and gels, the troches, the tablets, which are the rapid dissolve tablets, the sublingual tablets, sublingual solution, lozenges, injections, suppositories, and pellets. And some common uses of testosterone for women: of course, hormone replacement therapy for perimenopausal and menopausal women, the hypoactive sexual dysfunction, or HSDD, vaginal dryness, and vulvovaginal atrophy, and that's just the thinning, drying, and inflammation of the vaginal wall. So some side effects of overdosing testosterone: nightmares, excess libido, facial hair, male pattern scalp hair loss, oily skin, and acne. And I should add rage, aggressive behavior, just feeling a little more anxious and intense. And a lot of women will come in and just go, okay, I'm getting acne, I'm getting a lot of hair and growth on my back, or I keep having to pluck the hairs on my face. So some clinical pearls. There's a metabolite of the male hormone testosterone, nicknamed 3-beta-diol. It upregulates or it turns on estriol, and estriol is the protective estrogen. And of course, that's the main estrogen in pregnancy. It's a tumor suppressor agent and it's an anti-inflammatory agent. If a metabolite of testosterone is turning it on, it's very protective against breast and other hormonal cancers. Research shows that for testosterone to work optimally, estradiol must also be optimized. And testosterone cannot attach to your brain receptors without enough estrogen present. So there has to be an intricate balance between these hormones. If testosterone is taken with estradiol, it lowers your cardiac risk. And if your estrogen levels are low and you take testosterone alone, it can increase plaque formation in the vessels of your heart, increasing your risk for heart disease. And testosterone is much safer on the skin or vaginally versus taken orally because it is very hard on the liver. Testosterone should not be given by itself since it can be converted into estrogen endogenously, and be sure to give adequate amounts of progesterone for hormone balance. And again, all of these hormones have to be intricately balanced for them to work effectively and give you the benefits that you need. And here are some wonderful references that I would encourage you to go to and read and be guided by these scholars. You've got Dr. Pam Smith, who is the guru in women's hormones. So you have Dr. Berkson, who is a scholar, and she teaches all over the world, mentors practitioners and other medical professionals in hormone management. Dr. John Lee is the pioneer in bioidentical hormones. He was one of the first to talk about hormone balance. And Dr. Jonathan Wright was one of the OGs of bioidentical hormones, and he talked a lot about urine testing, which we did not talk about this time as far as testing goes, because there will be another webinar on hormone testing and what to look for and what types of testing to do. And of course, Dr. Hertog, he is a world-renowned guru in endocrinology and hormone management. Connect with our network pharmacies. Any questions or concerns that you may have, if you are close to any of these pharmacies and have any questions on any compounding issues, or if you have hormonal imbalances that you are seeking advice, please get in touch with us. We are here to help. Thank you so much for your attention, and we look forward to the next hormone webinar.